Michelle. I'm here with Caleb and China, and we're going to perform a cesarean section for you today. We come with several different new techniques that we've brought into the emergency room for the skin-to-skin, which is also called the kangaroo care. First, we've moved the IV poles down towards the end of the bed to allow a little bit more room for the baby, dad, and everybody to have a place for the actual skin-to-skin. We've also put the warming blanket down towards the legs so that it allows us a little bit more room, for mom to have the room for the baby, which is another really good feature. The last thing that we've done, we've moved the electrodes off to the sides so that baby has a clean access towards mom's breast. We've also moved the field down 6 inches to allow a little bit more room for the skin-to-skin contact. Mom, how are you feeling today?
Feeling a little bit anxious, but I'm ready for it.
You ready?
Yeah.
So what was the original birth plan?
Well, the original birth plan was vaginal, but due to complications, we had to do the cesarean.
Okay.
Yeah.
Okay. And did you plan on the skin-to-skin and breastfeeding for the entire
Absolutely,
visit?
absolutely. If we could do it the whole time, we want to do it the whole time.
Wonderful. Well, here at this hospital, we do the rooming in, which is going to be great for your breastfeeding and your skin-to-skin. We definitely are a promoter for that. Once the procedure gets started, we'll make sure that the baby looks good before we come to you. If you're not stable and you're not doing well, we will have to give the baby to Dad to do skin-to-skin. Is that okay?
That's fine.
Okay. Dad, are you prepared to do the skin-to-skin?
Yeah, I'm fine with that.
Wonderful. Have you did any preparation classes for this?
We have.
The breastfeeding classes, so you're familiar with the kangaroo care and
Yes, how it stimulates and it helps with the heart rate and breastfeeding. Yes, we
wonderful,
are.
and it also helps control the warmth of the baby, which is really good.
Uh-huh.
So when the baby's around this area, it kind of stimulates your body to start producing some milk. So this is wonderful. When the baby does latch on, you're going to start feeling a little bit of contractions coming from the uterus, which is very normal, okay?
Okay, okay.
All right, so are we ready to get started?
I think we're ready.
Wonderful. If I can see your ID,
Okay.
and if you can tell me your name and date of birth.
China Claim, February 1898.
Wonderful. And can you tell me what procedure you're here for today?
Cesarean.
Wonderful. If you note, we do not have her hands tied down. This is going to help with the holding of the baby during the skin-to-skin. All right. Well, are we ready to get started?
Yeah.
Wonderful. Let's get that baby.
All right.
Doctor, are we ready? Great. All right. Here we go, Mom. Oh, we have a healthy baby girl.
She looks just like you.
Does
She
she?
Yes,
looks
she does.
wonderful.
Oh.
Dad, would you like to cut the umbilical cord?
Sure.
All right. Mom, look at the beautiful baby girl.
Oh my gosh.
Let me dry her and stimulate her. Oh, do you hear that crying?
I
She's
hear it.
picking up. Wonderful. How are you feeling?
I'm feeling good. A little bit emotional.
Oh, that's normal to be expected. You've got a beautiful baby. You did a great job, Mom.
Thank you.
I hear her crying. Her tone looks good, so we'll continue with the skin-to-skin.
Now, when can she start breastfeeding?
She can start breastfeeding immediately. So are you comfortable to get started
I
now?
am. Mhm.
Wonderful. I'm going to help you with the placement of the baby.
Okay.
And let's make sure we keep that baby nice and covered with a nice dry one. And put a hat on to help keep the heat in. Wonderful. We gave you a beautiful bow there.
Oh, thank you.
So, do you feel like the baby's latching on well?
She's latching.
Wonderful. It is so important for the baby to get your flora as compared to the nurse, so it just does wonders for the immunity.
Okay.
Do you have any questions, Dad?
No.
No? Okay. Anything you want to add? Okay.
Back to you guys.